Hello and welcome to this training podcast to launch the Discharge Medicine Service at Addenbrooke's Hospital. My name is Paul Selby and I'm one of the lead pharmacists leading the project here from the hospital, and I'm very pleased to have joining with me on this podcast Rita Barley, who's the Chief Executive of the Local Pharmaceutical Committee for Cambridgeshire and Peterborough, and also Janet Watkinson, who's one of the pharmacists at the CCG, and they're going to join me to talk about the benefits of the Discharge Medicine Service. For those listeners unaware of the Discharge Medicine Service, the Discharge Medicine Service is a nationally commissioned essential service for community pharmacies to support with the reconciliation of medicines between secondary and primary care, with a particular focus on discharge from hospital. It allows referral from hospitals directly to a patient's nominated community pharmacy, who will ensure changes made during the hospital stay are continued in primary care. The review should prompt clarification of medicine changes and a check of the patient's understanding for the change in medicines. Further information on the service and the service specification is available on both the NHS England and Improvement website and the Pharmaceutical Services Negotiating Committee website, which also has a link via the Cambridgeshire and Peterborough LPC website. I'm very pleased to be here with Rita Barley. Hi, Rita.
Hi, Paul.
And Janet Watkinson.
Hi, Paul.
And they're representing the LPC and the CCG respectively. So, Rita, I thought we could start by discussing, or could you tell me what are the benefits for community pharmacy from this service?
Sure. Well, we all know of all the evidence of the increased risk of harm from medication when patients move from one setting to another. And just by being aware that one of our patients has been in hospital should help community pharmacies manage that risk and hopefully reduce it. And receiving clear communications from the hospital in a timely and secure way of any medication that's new, any medication that's stopped, will help the community pharmacist manage that pharmaceutical care of the patients, which is, I think a huge thing. And most importantly, is that the delivery of the discharge medication service is a contractual requirement for community pharmacy within the NHS contract, and it's very much part of the essential services. So the community pharmacist must deliver it, and we're also funded to deliver it.
No, that's great, Rita. And if I could just add a bit of experience from the hospital side of things, of the benefits that it's going to give us. And you absolutely hit the nail on the head with the studies showing the risk of the reconciliation of medicines between hospital and primary care is so huge. And I think this is a really good and positive step. So, yes, and in addition, for us as a hospital, it provides a really good IT solution to the problem of trying to get that information out. In the past, we've tended to have to fax or print out PDF and then send by email, and it's been quite a difficult thing to do. Going back to the studies and the errors in reconciliation, I think for us it's a natural next step. So the hospitals are often very good at producing discharge letters, but not so good at providing discharge information for patients on their medicines and how to access support. So I think that for us is the logical next step on how to support patients with their medicines. And the new framework will help to standardise the referral process that we have, both in terms of the information we include and the way we do it, and sort of the style of information, the type of information. One of the things that's going to be very exciting for us, I think, and I'm sure you'll share the excitement, Rita, is because of the way we're doing this using software is we will be able to monitor and track the outcomes of the actions, and I think there'll be really good data to show that we're referring the right patients and that they're leading to good actions. Janet, I was hoping you could just tell us a little bit about how the Discharge Medicine Service is going to affect the CCG.
Yes, of course. One of the things that we are looking towards is, of course, the 1st of April 2022, when we become an integrated care system. And as such, Cambridge and Peterborough CCG becomes one care system because we are extremely large CCG. And this programme helps to bring community pharmacists into the heart of the ICS. Traditionally, they seem to have been slightly outside, but with them being part of the primary care networks and are now as part of the ICS and becoming back from being commissioned by NHSE to being CCG commissioned, which we hope will take place on the 1st of April, it does mean that instead of having to go through a third party traditionally, which is what seems to have happened to community pharmacists when dealing with patients and patients' medication, we've had queries come into the CCG, which we've then fed back to secondary care. This means that community pharmacy can have a direct link into secondary care, which makes them part and parcel of the whole process. From a medicines optimization team, we are utterly delighted to be welcoming in this discharge service, both not just for Addenbrooke's, but also for our other trusts as well, North West Anglia and indeed Royal Papworth, which means that every patient should be treated equitably across the system, which is, of course, the heart of commissioning.
That's fantastic. It makes it just really sit into how important it is and how good an opportunity this is for pharmacy to be involved in and leading on that. That's excellent. I thought it might be helpful just to go through a little bit about the some sort of more of the logistics and how it all work together. So I thought I might just touch on some of the patients that we are going to refer and how we've got around that, and then maybe Rita, you could come in and let us know how the community pharmacies will use that information. But certainly from our experience of who we think would benefit from the discharge medicine service, we're going to start by trying to get the patients who we're already seeing and trying to get the information over to community pharmacies and bring that online first. So typically this would be patients who have issues with supplies or concerns or problems or queries about supplies, and for us they fall into two main gaps: the patients who are on MDS support and the patients who are on restricted supplies, and we think that'll be a really good start, and we'll essentially get that IT process going. We've actually got far broader criteria for referral than that, and it's based on the criteria and the guiding documents that NHS England and Innovation have put out. And so we will be looking at either high-risk drugs or high-risk patients as our two sort of criteria. And as you can imagine, the high-risk drugs will reflect those which have narrow therapeutic windows, and the high-risk patients will be those with polypharmacy or newly started medicines and that kind of stuff. So I think there's a great opportunity for this, and that'll be really good. And I think one of the things we would be keen to do is to support the complexities around sometimes when we're starting and stopping medication, and in particular when we're looking at antidepressants or antiepileptics and switching one therapy over to another. I think it's really important that the community pharmacy is aware of that switch and able to support the patient from one therapy to another. So I think those would be another group that we'd be really keen to support and keen to get the information so that the community pharmacy can support the individual patient. Rita, I was hoping you could just tell us about how the community pharmacists will use the information and what you will do with the discharge, what they will do with the discharge summaries.
Sure. First of all, that's a great list of conditions and high-risk meds, because I know through many years of working as a community pharmacist, just having that information will be so useful, because they often spend, as you know, a shorter time in a hospital, but spend the rest of their time very much managed within primary care. So great. The actual mechanics of the service, first of all, is in great detail on the PSNC website. So I expect all the community pharmacists and the technicians to have read the spec. But what I would suggest that everyone will do is, as soon as they receive the information on a particular patient, they'll compare what's been discharged, the medication on discharge, with their own PMR record. And if it's someone who is on a Dosset box particularly, is to check that there isn't one being processed at the moment or waiting to be delivered. And the same would apply for other medication, because sometimes there can be a prescription that's being processed while the patient is at hospital, so that they will stop that process until the pharmacist has time to compare the discharge information with their own PMR record. And then if there are any issues or concerns, they can raise them immediately with the person, the contact in the hospital or the local GP as necessary. Then I would expect the pharmacist or the technician to make a record on the PMR, so that when the next prescription is received, that again it can be checked with the discharge information, and there's another opportunity to raise any issues and concerns. And also the third step is a very important step, is to have the discussion with the patient to make sure that they understand what's going on and make sure they're happy with the medication, the usual concordant discussion. And also that's an ideal opportunity to offer other services that may be appropriate, like the new medicine service, and also to make any lifestyle interventions now that our pharmacies are all healthy living pharmacies, and either deliver the stop smoking service themselves or refer to another stop smoking provider. And also there's other support, like making patients aware of voluntary organisations like Diabetes UK, or organisations such as Caring Together, which may be appropriate for some patients. And really, for me, the summary is to just improve the pharmaceutical care that we all within pharmacy offer.
So many positive things there, Rita. That's
so many positives,
and so much potential, and so many things that would be really nice to link those community pharmacy services in with sort of the patient's more generalised healthcare. Actually, to that end, Janet, I didn't know if there's any plans to expand the way we use DMS, or how we can support the CCG with sort of that medicines information.
Well, I think one of the things that, as you know, we are undertaking is a look at polypharmacy. And eventually, one would hope that our, if you like, recipe for polypharmacy would tie in with secondary care's policy as well. So we're actually all working in the same way, with the same group of patients, but just expanding it. And I think the other thing that we have to consider is that there are a number of services that are going to move into primary care. And I'm thinking about sort of some of the infusion services, some of the biologics which may start off earlier in primary care rather than being settled in secondary care. And these are all the ideas that are coming forward, and DH are working at looking at them. And I think this is one other area where the DNS will actually be incredibly important when these patients come out, if indeed their prescriptions are going to follow them into the community, because this is a raft of medicines that traditionally community pharmacists haven't dealt with. And so working together is going to be very important. And it would be I believe it would be up to the CCG to facilitate this working and moving the whole project forward and supporting.
Fantastic. So I'm really grateful for you both to take the time just to explain it. I think it just really emphasises how important it's going to be in the future, what a good opportunity it is. And just to touch on one last thing before we go, is just to highlight that there is going to be training around this, and significant training. And we're doing, so those who are listening from Adam Brooks Hospital, we're going to be doing a series of local training, and there will be resources and videos for you to look at after that. Rita, there's webinars, I think, for the community engagement, isn't there?
Yes, sure.
And that would be for everyone as well. So that'll be the case. And Janet, as things take off at the CCG, I'm sure we'll be out and conversing more. So plenty of opportunity to get more information on it. So thank you for listening to our training podcast. I hope you found it engaging and interesting. And If you're interested in finding out more, the LPC will be hosting a event online as part of our larger launch of the Discharge Medicine Service, and that's on the 23rd of June 2021 between 7:30 and 8:30 p.m. If you'd like more details for that, please get in touch with a member of the LPC, CCG, or myself. And I just want to say thank you to Rita and Janet and all the teams that have been working on this behind the scene at the LPC, the CCG and CUH. And also a special thank you to Sophie Castle-Clark at the Eastern Academic Health Sciences Network, who has really supported the group to roll out and implement the initiative.